Hi everyone, welcome to week 3 of your Pharmacy Career Planning 2 course. This week we are going to be covering chapter 11, and chapter 11 is on nuclear pharmacy. Nuclear pharmacy is definitely a different type of pharmacy than probably anything else that you're familiar with. Basically, we have two types of nuclear pharmacies. We have an institutional nuclear pharmacy, which actually is within the medical department of an institution, and then we have a centralized pharmacy, which services a number of different sites. So what we're going to be looking at is what does a nuclear pharmacy do, and what it would be your role within a nuclear pharmacy. So basically, in a nuclear pharmacy, we are preparing, storing, and dispensing radiopharmaceuticals. So what that means is that we are handling all of the radioactive drugs that are used for a variety of reasons. And those are typically things around more diagnosis than treatment, really. But the diagnosis piece is, when we go in for any kind of diagnostic test and they use any kind of radioactive material, whether they're injecting it into the bloodstream, things like that, and then they're doing scans, that's what we're talking about here. So because of the way that the medication is entered into the body, whether it's a diagnostic medication or treatment medication, because it goes straight into the bloodstream, that's why the sterile compounding is so important with this type of pharmacy scenario. So we are definitely going to be doing compounding and dispensing within this type of pharmacy setting. And as I said, there's basically two kinds. There's institutional and centralized. So institutional means that we've got this pharmacy that's in and of itself within the nuclear medicine department in a facility. So say you've got a nuclear medicine department in your facility, you're going to be conducting these tests and things like that. You have your own pharmacy right there in the department. That's an institutional nuclear pharmacy. The centralized nuclear pharmacy simply means that we have our regular pharmacy and we have nuclear pharmacy within it. And so we service a lot of customers, whether it is departments within our facility or outside of our facility. So that's what that means. So what we're going to be dealing with is radioactivity and radionuclides. So these are just anything that has some sort of a radiation that's released. And the idea here is that this radiation is then used to diagnose or treat disease. So that's what you're going to be dealing with as far as the pharmaceuticals go. So we have, compounded ones, things where we have to put them together. So basically what we're doing is we are putting in some sort of a tracer that delivers that radionuclide to a desired area, and we're able to see what is going on, what it's doing. So they're going to kind of introduce you to some of those specific drugs that are part of that. There are adverse reactions, but they are fairly rare. And it typically is more of the carrier drug that they have a reaction to rather than the radiopharmaceutical themselves. An adverse reaction could be anything like nausea, vomiting, that kind of stuff. Now, when it comes to working in a nuclear pharmacy, we obviously have personnel, we have inventory, we have a specific pharmacy design, equipment, and supplies, and then delivery, getting that medication to where it needs to be. So the nuclear pharmacy technician has to have some sort of specialized training in the handling of these radioactive compounds. Not everyone can be a nuclear pharmacy technician. Even the drivers have to have special training in how to handle the radioactive material. And then, of course, we have other personnel, the billing folks and things like that. Obviously, our inventory is going to be very different. It's going to include those drugs that have separate classes than anything else because they are part of this. And our inventory is going to be very limited because these drugs do decay rapidly, and so we have to be prepared to, for those kinds of changes. The design has to be such that we are able to keep that radioactive material from affecting other employees, and we have to make sure that we are properly kept safe when working with them. There has to have limited access and those types of things. So we're looking at hoods and glove boxes and lead line storage and things like that. So as you go through and you look at this unique type of situation this week, please reach out to me if you have any problems or questions, and have a great week.